Hello, everyone. We are Logan and Dylan, and we will be presenting the negative effects and flaws of the Western world on global malnutrition. Starting with me, my name is Logan, and I am a rising senior attending Tesoro High School in California. A couple extracurriculars that I'm involved in include being a semifinalist for a medical research internship, being an auxiliary volunteer at my local hospital, and having numerous leadership positions within my community and school. Overall, my career focuses and passions lie within molecular biology research and community/public health. One of my biggest motivations for presenting this specific topic is my mom. Although my mom is a bit of a health nut, she helps meal plan, cook, and recommend new substitute foods to my grandma, who suffers from diabetes. Although sadly, my family case is unique in the sense that we have access to these healthier foods because we live in the United States. But as me and Dylan will get into, there exist many nations without access to properly nutritious food, resulting in global malnutrition.
Hello, I'm Dylan. I'm also a rising senior at Tesoro High School. A few activities I participate in include being a founder of my school's Olympiad team, a finalist for my Meyer internship, and a treasurer at my local community outreach organization. I'm interested in pursuing a career in biochemistry with a focus on public health. My motivation for this project comes from my aunt, who suffers from multiple food allergies. As a result, she has to stray away from processed westernized foods and drinks because they contain excess chemicals. While I was fortunate enough to live in an area with more food variety and accessibility, by presenting today, I hope that we can bring awareness to the negative effects of westernized food and places with less food variety. Western world food often refers to eating habits primarily in North American and European countries. It's often characterized by the use of meat and dairy products, as well as grilling, baking, or frying food, but also has a plethora of chemical differences to international food. For starters, Western food contains many added sugars, such as high levels of fructose and sucrose. A good example of this could be found in the United States, where the average person's daily intake of added sugars was 17 teaspoons, or nearly 3 times the global average. This massive surplus is directly linked to high rates of diabetes and obesity. Moreover, Westernized food also contains increased fat or triglyceride content. The Western diet comprises of high concentrations of saturated and trans fatty acids while containing low levels of the healthy cis unsaturated fatty acids. While the West aims to regulate the production of harmful trans fats, many European and American corporations like Unilever, Nestle, and McDonald's found loopholes claiming their products are partially hydrogenated, allowing them to serve trans fats. Trans fatty acids have been associated with heart disease and other cardiovascular conditions, and with Western foods slowly being made more global, we see a recent spike in cases of cardiovascular disease worldwide as high cholesterol becomes pandemic.
However, increased cardiovascular disease are not the only food-related health issue being caused. In broad terms, malnutrition can be split into overnutrition and undernutrition. Overnutrition is the excess consumption of calories or nutrients and can result in obesity, heart disease, or other illnesses. Undernutrition, on the other hand, involves both insufficient calories but also a lack of essential micronutrients. Both can lead to stunted growth in children, impaired brain development, anemia, and other illnesses. Using obesity and stunted growth as measures, obesity mainly plagues the West, South America, the Pacific Islands, and the Middle East, while undernutrition is more common with Central Africa and much of the Southeast Asia. Individually, we will go over the two definitions of global malnutrition using certain nations as examples, and describing how the West is at fault or fails to amend their circumstances. One of the most extreme cases of this Western impact on malnutrition is Samoa. According to the data compiled by the Global Nutrition Report, 58.4% of adult women and 43.8% of adult men have obesity, making it rank number 8 for the highest obesity rates globally. Additionally, diabetes is estimated to affect nearly 1 in 3 adults. So how does this happen and what are the causes? The most clear and undeniable source for the obesity rates is the food eaten. In traditional Samoan diet, fish, tropical fruit, coconut, leafy greens, and root crops were eaten much, with the rich and fatty foods being both prized and uncommon. Diets nowadays are now packed with starches, sugars, and most importantly, canned goods, with Spam and corned beef being the most prevalent. This nutrition transition was brought upon by Western countries, mainly the United States, New Zealand, and Australia. In 2021, Samoa was estimated to import 30.9% of their food, with a majority of it being the cheap, nutritionally inadequate canned goods. This importation of high cholesterol food, along with Samoan culture revolving around showing love through abundant food, and Samoan genetics retaining fat more easily, form a lethal combination leading to obesity and diabetes. Ever since the introduction of ultra-processed foods from the Western world, Samoa's culture and health have been more and more at odds. As Geert, who has done a case study on Samoan nutrition, put it, newer imported foods are just too tasty, too ingrained in Samoan diets, and too deeply embedded into Samoan culture itself to cut out entirely. What's more is that the example that we've used from Samoa is also applicable to many of the other import-reliant nations in the Pacific Islands as well. However, it isn't just overnutrition that is a negative effect, but also undernutrition.
In contrast, an example of severe undernutrition is seen with Yemen. The World Food Program found that around 19 million people in Yemen are faced with food insecurity. A study done by the US Embassy also found that 46% of children suffer from stunted growth due to extreme mal and undernutrition. Similarly to Samoa, we ask ourselves, why is Yemen suffering a malnutrition crisis? Yemen is currently experiencing high rates of undernutrition due to political and economic instabilities. Limited food accessibility resulting from a disrupted crop supply chain is a major contributing factor as it hinders the distribution of food to the population. Additionally, economic instability has led to high food prices and inflation, further exacerbating the challenges faced by Yemeni citizens. Moreover, the lack of dietary diversity, with diets predominantly consisting of grains and legumes, but lacking in proteins and vegetables, contributes to food deserts conditions in Yemen. These factors can collectively contribute to the undernutrition and malnutrition crisis in the country. So how is the Western world flawed? Well, while the intervention techniques employed in the West are helping alleviate the crisis and they're somewhat effective in the short term, they contain some issues. Before humanitarian intervention can take place, there are many barriers it has to face, such as political constraints, resource limitations, collaboration, and cultural understanding. However, once humanitarian aid provides support, they try to keep the hunger at bay rather than targeting the root of the problem. Moreover, Western humanitarian aid often ignores Yemeni voices who would be vital to mitigate the long-term problems faced. All in all, while humanitarian aid has been effective in reducing short-term undernutrition, it is often inadequate in permanently solving the issue. In conclusion, while the circumstances we've discussed can seem very challenging to fix, it is by no means a hopeless cause. In recent years, many Samoans have dedicated to adopting non-Samoan means of improving health, such as CrossFit, and the Samoan government has been pushing for fruits and leafy green vegetables to be eaten more through grassroots campaigns for better health. In Yemen's case, UNICEF and the World Food Program have been implementing nutrition-specific programs to treat acute malnutrition among children, give nutrition education for caregivers, and address the underlying causes of food insecurity and malnutrition in Yemen. We recommend to keep up with global malnutrition and its Western impacts through the World Food Program humanitarian efforts. We also encourage people to read the yearly Global Nutrition Report, which includes profiles of country nutrition data as well as finance and advocacy for global nutrition.
Here are our references, which include government reports and online articles. And thank you for listening. If there's any questions about our presentation or the websites that we mentioned to keep up with global malnutrition, we've attached our references here. Thank you.